We are talking about tubular secretion. This is the third step of urine formation, and after this step, urine will be formed completely. So when I talk about tubular secretion, basically it means the separation of unwanted substances. All those substances which has escaped the ultrafiltration will be secreted under tubular secretion. So I can say separation of unwanted substances from the peritubular capillaries and secreting them back into the filtrate is tubular secretion. This tubular secretion involves basically all those substances which has escaped the ultrafiltration. It means it was supposed to be thrown in urine during ultrafiltration, but it got absorbed in the blood under certain condition. So it will be thrown out. Substances which has escaped ultrafiltration will be absorbed here. It is also known as active secretion. So tubular secretion is an active process. Tubular secretion takes place in DCT, that is distal convoluted tubule. So if I take this as the nephron, so all those unwanted substances which was absorbed during ultrafiltration or during tubular secretion, basically it got absorbed. So here from the peritubular capillaries will be thrown back into the DCT. Now which are those substances? It can be K plus ion, H plus ion, urea, uric acid, creatinine. All these are harmful to our body. So it has to be thrown out. So it is thrown out by the help of the tubular secretion, penicillin, ammonia, etc. So from the peritubular capillaries, I will say that this harmful nitrogenous waste will be thrown back into the DCT, and from DCT it will travel into the collecting tubule. So let's understand in this, the urine here now will become hypertonic. Why it will become hypertonic? Reason is very much simple, because of accumulation of more toxic substances. And this is how the urine formation completes. So we need to understand that collecting tubule absorbs more of water, so making the urine hypertonic as well as making it concentrated. Hypertonic urine means having less water and more of nitrogenous waste. That is what is hypertonic urine. So this is how ultrafiltration, selective reabsorption and tubular secretion results in the formation of urine. So this is how urine formation takes place. The excretion. Now see what happens to the urine. Now here, urine that is formed per day in human body is 1 to 1.5 liter. That much urine is eliminated every day. When I talk about appearance of urine, the urine appears to be transparent. Mostly it is transparent. Sometimes it is yellowish in color. And if it is yellow in color, it is due to presence of urochrome, a pigment that results in the change in the coloration of the urine. So urine is 1 to 1.5 liter, transparent, and it is sometimes yellow due to urochrome. The urine has different composition. So we understand that there are three steps involved in the formation of urine: ultrafiltration, selective reabsorption, and tubular secretion. And after these three steps, the urine will be formed. Now the point here is, what are the different basically nature and you can say appearance of the urine. So I can say nature wise urine is acidic. Why it is acidic? It is due to the presence of Na2H2PO4. This is very important chemical that makes the urine acidic. So if somebody asks what is the nature of urine, remember it is acidic. What is the odor of urine? Odor of urine is aromatic. Yes, it is aromatic. It smells, the pungent smell that comes out, it is due to urinoid. So when you pass on the urine in the air on the land, so till initial phase it is aromatic, but after some time what happens, the bacteria that is present in the air, it starts acting on the urine, and finally it breaks the urea into ammonia and carbon dioxide, and that is why you get that pungent irritating smell. Otherwise normally urine is having aromatic smell. We have the next characteristic, that is specific gravity. Specific gravity means it is with respect to water. If the specific gravity is more than 1, any object will sink in the water. If the specific gravity is less than 1, it is going to float. It will never mix with the water. And if it is exact 1, it will float. So here urine specific gravity is slightly more than 1. It is 1.015 to 1.025. pH of urine, it is going to vary from 4.8 to 7.5. So it can be slightly alkaline also. But average pH of urine is 6. Let's look at the chemical composition of urine. Let's look at the chemical composition of urine. So when I talk about chemical composition, every urine basically consists of water 95%. It has calcium, potassium, NaCl, ammonia. Urea is there 2% to 2.5%. Creatinine is also found in urine 1.5%. Uric acid, one of the nitrogenous waste, it is 0.2 to 0.05%. Then oxalic acid is present, it is 0.015%. So this is how basically your urine is chemically composed of. The percentage can vary depending on your diet, depending on your health. So this was chemical composition of urine. Let's understand the types of absorption, because we in urine formation we saw that there is absorption going on, selective reabsorption and tubular secretion. So the types of absorptions we need to study. So there are two major types of absorption. One is basically called as obligate absorption. When I say obligate, it means it is fixed. It is not going to change at all. Facultative means it will change depending on the requirement in the body. That is what is called as facultative. Varying depending on the concentration, depending on the requirement of the body, hypertonic and all. So let's understand this. Obligate, like for example, no matter how much glucose is there in your blood, your body will absorb all the glucose. That is a kind of fixed absorption. Body will never lose glucose in the urine. It is a fixed absorption. And facultative means depending on the requirement. Let's understand one very important word that is called as renal threshold. So when I talk about renal threshold, renal threshold means the maximum absorption in the blood. Maximum how much your blood can hold. That is very important part. So let's understand here. Maximum absorption in the blood is called as threshold. For example, we have sugar. Sugar, let's say for example, your cell has the capacity of 500 glucose molecule, and in your blood there is 550 glucose molecule. So the cell will absorb 500 glucose molecule, no doubt. 500 glucose molecule will be absorbed. But remaining 50 that is there in the blood, what will happen? So this remaining 50 sugar will be passed on into the urine. So this is basically what is called as renal threshold. It can absorb to its maximum, but not more than that. So sometimes if you have little bit of sugar in your urine, it's fine. It was just because it was your threshold value has crossed. Glucose 120, 180 mg per 100 ml of blood is the range. So if you go and do your glucose test, you should be having 180 mg per 100 ml of blood, not more than this. If more than this is there, then it means you are going to suffer from diabetes. That is diabetes insipidus and diabetes mellitus. There are two types of diabetes. When I say diabetes mellitus, it is due to the failure of insulin. And when I say diabetes insipidus, it is due to more secretion of water due to the loss of functioning of ADH. What is ADH? Anti-diuretic hormone. So let's understand this now. When we talk about the role of accessory glands, we have some accessory excretory organs also that plays an important role in excretion. Now when we talk about accessory, so the example that we have is skin, we have lungs, we have liver. These are all involved in excretion. Let's talk about the very first excretory organ, that is skin. So skin is not helping in excretion directly, but yes, it is helping in eliminating few nitrogenous waste. Like for example, it excretes out salt, it excretes out little bit amount of urea also, and it excretes out during the time of sweat. So whenever we talk about skin, skin has two layers basically. So skin is thin and it is permeable in human being. It is permeable to water basically. So the sweat comes out through those small pores, that is called as sweat pores. Diffusion of ammonia takes place through skin. Sometimes your sweat gives out very bad odor. That is purely because of the skin. So if skin is thin and permeable in human, there is diffusion of ammonia taking place. When I draw the diagram of skin, what things you will observe? So the skin basically consists of upper layer, that is called as epidermis, and below the epidermis there will be a layer called as dermis. And in the skin you are going to get sebaceous gland, the sweat gland, and small hair follicles. These are very important part we need to understand. So here you can see the epidermis, the dermis, and there will be few pores present. So this pore is, let's take of sebaceous gland, then the sweat gland pore, and hair follicle will have a separate opening. So let's do the labeling. This is nothing but the hair follicle. This is sweat gland that is produces sweat, and this is the sebaceous gland. Sebaceous gland is responsible for producing waxy secretion. That is a kind of coat. So let's understand. Skin is one of the important accessory excretory organ. The sweat secretion is under the control of sympathetic nervous system. Sympathetic nervous system means it will increase on certain stimulus. Like when you are scared, under fear, you will sweat a lot. When your body is in high temperature, it is going to sweat a lot. So sweating is under sympathetic nervous system. Sweat gland is responsible for secreting sweat, which is also known as sudoriferous gland. Sweat gland produces sweat. What is the composition of sweat? Sweat normally consists of 90% water and inorganic salts. So it has 90% water, inorganic salts. Along with that, it has urea present in it. Urea will be very less. If the urea in sweat is very high, it means your sweat is giving out very bad odor. Normally, the sweat is acidic. It means it is hypotonic to the plasma. So normally the sweat is acidic. It is hypotonic to plasma. The next important part here is the sebaceous gland basically. Sebaceous gland is present at the base of hair follicle. So at the base of hair follicle, sebaceous gland is present. This sebaceous gland is responsible for secreting a chemical called as sebum. Sebum is nothing but is a type of waxy secretion. Sebum is a type of waxy secretion. Sebaceous gland mixes with sweat and it makes hair soft. So this is what we need to understand under sebaceous gland. Let's talk about the next important part. This is the first excretory accessory organ, that was skin, having sweat gland, sebaceous gland, and the hair follicle. The next that we have is the lungs basically. We all know that lungs is involved in respiration, or even we can say breathing. So lungs normally what it does, it takes in oxygen and it gives out carbon dioxide. But along with carbon dioxide, water is also lost in the form of water vapor. So lungs also plays an important role in excretion, but it excretes out all the volatile waste. Next is ear. Your ear consists of specialized gland The gland present in the ear is called as ceruminous gland. And this ceruminous gland is going to secrete something called as wax. This ceruminous gland normally it produces white wax, but when we clean our ear, we get brown colored wax. The reason behind this is whenever somebody speaks, he actually pushes the air in your ear, and if there is any dirt particle present in the air that will enter in the ear, it will stick to the wax and make the wax brown in color. So remember, wax is normally white in color. So it here basically a ceruminous gland which produces cerumen. Cerumen is nothing but it is a wax. Now wax is also a type of excretion. It is removal of waste basically. If there is excess of waste present in the ear, it will be removed out. Then we have role of lungs as we discussed earlier only. Lungs are involved in breathing. So it helps in taking in oxygen and giving out carbon dioxide, and they excrete what kind of waste? So we can say lungs is involved in excreting volatile waste. Volatile waste means the waste which is not at all in liquid form. So carbon dioxide and water, it comes out in the form of vapor. Carbon dioxide goes out as the gas. Because of lungs we are able to breathe. So this is excretory organ that is involved in excretion. So lungs also plays a very important role in excretion. Let's talk about the next, that is the role of kidney and kidney disorders. Because we have studied that kidney plays an important role in excretion. But if there is some problem in the kidney, what disorders you are going to suffer from? So I can say there's a technical term to it called as renal failure, or even I can call it as kidney failure, or even it is also called as renal insufficiency. So these are all technical terms involved. It's a medical term. When doctor says renal failure, kidney failure, renal insufficiency, it means what? The kidney has failed to produce the nitrogenous waste. Kidney is not able to filter that waste. Kidney is not able to filter the toxin. So kidney has failed to produce or filter toxin and waste from the body. That's why the kidney has become insufficient. There are two types. One is called as AKI, that is acute kidney injury. The second type is CKD. CKD stands for chronic kidney disorder. Chronic means the most dangerous one, but it's AKI and the CKD. So when I say AKI, it is acute kidney injury. So let's understand, if there is decrease in the GFR, what is GFR? It is glomerular filtrate rate. Then how we will come to know that kidney has failed? If there is high amount of serum creatinine in your blood, high amount of serum creatinine level in the blood will indicate kidney failure, because creatinine is such a chemical which should not be stored in your blood. It has to be always eliminated out in the urine. But if kidney is not able to filter the blood and creatinine is getting accumulated in the blood, then it leads to kidney failure. It's an indication. So let's understand blood creatinine. First of all, the normal range of creatinine in the blood is 0.6 to 1.2 mg per deciliter. But if it becomes more than 8 mg per dl, so it indicates kidney failure. The kidney will fail. Let's talk about this. Malfunctioning of kidney is one of the basic reason, and that's why the person is suffering from kidney failure. Let's understand few important terminologies. That is very important. If I use this word, let us take in this way. There's a word called as glucose urea. Now when I say terminology, means these are all different important words which is having some clinical significance. It is an indication of some kind of abnormality in your body. So the very basic and the first terminology that we are going to study, let us take glucose urea. What is glucose urea? It is loss of glucose in urine. Normally your urine should not contain glucose, and this is very important. Then we have hematuria. What is hematuria? Loss of blood in urine. There should be no loss of blood in urine. If it is there, it means the blood has become extremely thin and it is able to pass through the glomerular capillaries also. Sometimes when people who take thinner as a drug, That time the blood becomes thin and they can suffer from hematuria. What is proteinuria? Loss of protein in urine. So if there is a protein loss in urine, it means that the person is suffering from proteinuria. How will you come to know that there is protein loss? See, whenever there is protein lost in urine, wherever the place where you urinate, it will result in the creation of lots of phase. What is phase? Like if you dip a soap in water and you stir the water, you can see some phase that is called as jhag. And all those stuff, when it's seen in your urine, wherever you are passing, it means you are suffering from proteinuria. The third one is glycosuria. What is glycosuria? It is loss of glucose in urine. That is called as glycosuria. So loss of glucose in urine indicates that. And how will I come to know that there is glucose loss in urine? So it's very simple to understand that wherever you urinate, if there is glucose present in the urine, all the ants will get attracted towards your urine. So accumulation or gathering of ant near your place where you have urinated, it indicates that you are suffering from glycosuria, that is loss of glucose in urine. Then we have dysuria. Dysuria means painful urination. The person is not able to pass out his urine more frequently. Painful urination, dysuria. Then we have something called as nocturia. Nocturia means more urine at night time. During daytime he urinates normally, but during night time he will urinate more than the normal amount. So it is also a technical disorder that is called as nocturia. More urine at night time. Nocturia. Then there is a word called as hypokalemia. There is a word called as hyperkalemia. We have to discuss all these words. So let's see. The next term is oliguria. Olig means less. Less urine output. The patient is not able to pass out urine. Normally, we have to pass out 1 to 1.5 liters of urine per day. But a person suffering from oliguria will pass out urine, let's take 300 ml per day. So he is suffering from oliguria. There is a condition called as polyuria. Poly means many. So there is more urine output. Now instead of 1.5 liter, he passes 3 to 4 liters of urine per day. It means he is suffering from polyuria. There is a word called as hypokalemia. Hypo means less. Kalemia means for potassium. So there is less potassium present in the blood. Hyperkalemia means more potassium ion is seen in the blood. That is hyperkalemia. These are all technical terms involved here. Few more terms. The first one that we have is polydipsia. Polydipsia means it is frequent thirst. When you are suffering from polyuria, you will suffer from polydipsia. Now let's talk about the next one. So polydipsia is like whenever you urinate more, there is less water in the body. So definitely you feel thirst. That is called as polydipsia. It is technically called as frequent thirst. Azotemia means kidney failure. If the doctor suggests that you are suffering from azotemia, it means it is kidney failure or even it is called as renal failure. The next technical term that we need to understand is basically called as enuresis. What is enuresis? It is bedwetting. We have seen young kids, they are at the age of 4 or 5, still they have not developed the power to control their urine, and during night time when they are sleeping, basically they pass out their urine on the bed. It means the person or the child is suffering from enuresis, which is a technical name, but in lame word it is called as bedwetting. Passing out urine during sleep. When you are sleeping, you are passing out the urine. No control on the external sphincter during sleeping time. So this is enuresis. So these are all different technical terms. Basically, oliguria, polyuria, hypokalemia, hyperkalemia, polydipsia, azotemia, enuresis. There are a few more terms. First is pyuria. What is pyuria? There is loss of pus in urine. What is pus? Basically dead WBC. So if there is loss of dead WBC, it is called as pyuria. Alkaptonuria. It's a very dangerous disease. It's a genetic disorder. In alkaptonuria, what happens? See, when you pass out your urine is transparent in nature. But the person who's suffering from alkaptonuria, when he passes out urine in and the urine comes in contact with air, due to presence of certain chemical in the urine will turn black in color. It means he was supposed to pass out white transparent urine, but as it came in contact with air, the chemical reacted with the air and changed the color of the urine to black. So this is a very dangerous genetic disorder, and it mostly results in the death of the individual because genetic disorders cannot be cured. In the old age, basically the people who are old, they also lose their control over the sphincter, so they cannot control their urine for longer time. So if they are not able to control their urine for longer time, it is called as incontinence. It is inability to hold urine. The one who is 60, 70 or 80 years old, he cannot hold his urine. It means there is a loss of external sphincter, and as a result he is suffering from this disorder. Micturition is what? It is the act of passing out urine. When you are passing out urine, the process basically it is called as micturition. So in case of old people and young kids, there is, in young kids the external sphincter is not developed, but in old age basically the external sphincter has failed. So this is all about the technical terms that is related to the kidney and kidney disorders. Let's talk about AKI. What is AKI? AKI stands for acute kidney injury. Acute kidney injury means the kidney is damaged and it is not able to work properly. It is functioning inefficiently. It is also known as ARF. What is ARF? Acute renal failure. The technical term given to it. It progressive loss of kidney. It means you can say progressive loss of kidney functions, or even you can say renal functions that leads to AKI, that is acute kidney injury. Generally, it is characterized by CKD or oliguria. What is oliguria? Less urine output, generally characterized by oliguria, less than 400 ml per day. So oliguria is less urine output. Body water and body fluid concentration gets disturbed. It means how much salt, how much water has to be there in the blood. That ratio, when it gets disturbed, that is what is AKI, also known as acute kidney injury. Acute is the initial stage, and this acute will lead to further something called as CKD. What is CKD? CKD stands for chronic kidney disorder. A chronic kidney disorder means the kidney has failed for sure. Let's understand the causes of AKI. The AKI causes can be pre-renal, it can be intrinsic, it can be post-renal. Pre-renal means before kidney some damage. Intrinsic means inside the kidney there is some damage. Post-renal means after the kidney there is some damage. So all these three are the reasons for AKI, and the treatment that is there is only one, that is dialysis. So if there is pre-renal, intrinsic or post-renal, it can lead to, it can be treated basically by dialysis. But remember, dialysis is not a perfect technique. Why? We will see later. CKD stands for chronic kidney disorder. That is called as CKD. Now in CKD, it develops slowly and initially. So this chronic kidney disorder starts very slow, but later on it becomes very dangerous. CKD is long-term consequences of AKI. Means acute kidney injury, when it becomes very prominent, it leads to CKD, that is chronic kidney disorder. Means your kidney is now chronic in nature, it is going to suffer from heavy problem, and your body will also suffer from it. So what can be the remedy for it? See, the permanent solution that I can suggest is only to go for kidney donor or kidney transplantation basically. But if you don't get donor, if you don't get any person for transplantation, then what you can do? You have to survive on dialysis. Dialysis is also called as artificial kidney. Dialysis. Dia means through. Lysis means loosening. So there is a technical name given to it. So dialysis is nothing but it is a dissolution. Dis means through. Lysis means loosening. So that is dialysis or dialysis. It is also called as hemodialyzer because the blood is entering here and dialysis is going to take place. It is used for AKI or CKD stage 5. The person who is suffering from acute kidney injury or chronic kidney disorder and has reached at the fifth stage of kidney failure. That time, the person has to undergo dialysis because there is no alternative left for him. If he is not undergoing dialysis, then he can die. So it is chronic renal failure that is responsible for kidney failure, kidney disease. For all those things, dialysis has to be done. So we will talk about dialysis